Thank you for your interest in Periogen Oral Rinse, the world's only alternative to expensive dental cleanings. We hope after viewing this presentation that you will try Periogen and you too can keep your teeth hygienists clean at home. This presentation is divided into 3 sections. The first section is a brief discussion about gum disease. The second section discusses the 3 ways Periogen may be applied. The first method is using a water flosser, also known as an oral irrigator or by brand names such as Waterpik. The second method is by swishing Periogen in the mouth as you would with any oral rinse. The last method is by brushing. The last section is a summary of benefits from using Periogen. First, a brief discussion on gum disease. Any dental professional will tell you that removing tartar is key to ending gum disease. That is why the dental industry is so adamant about scraping the tartar off your teeth. This photo shows an extensive tartar buildup. Dental tartar provides the habitat for bacteria to thrive. Together they form the principal cause of gum disease. If you have red, bleeding, or sensitive gums, chances are you have tartar buildup on your teeth. Periogen can painlessly remove that tartar buildup in the comfort of your own home. Tartar generally starts forming at the gum tooth margin. It will eventually extend deep into the gum line. This dental x-ray image shows how tartar appears beneath the gum line. Your dental professional would refer to this buildup as subgingival tartar. Left unchecked, gum disease sets in. The result is pain, bleeding, and ultimately tooth loss. Gum disease starts with simple gingivitis, progressively developing into periodontal disease. Your dentist may recommend a dental deep cleaning or even surgery to remove your tartar buildup. This can be a painful process since the gums are often already red or bleeding from gum disease and the dentist must scrape around those inflamed dental pockets with a metal pick. Dentists will often use Novocaine injections in an attempt to minimize any discomfort. Even with the advanced training dental professionals receive, the truth is that a dental deep cleaning is only about 50% effective at removing all of the tartar from your teeth below the gum line. The reason for this poor result is that the dentist cannot actually see into your gum tooth margin. They are essentially scraping blind around the base of the tooth. Tartar that is left in place will quickly become infested with bacteria and the gum disease cycle starts again. You have an alternative. Periogen Oral Rinse is the world's first dental tartar remover. Periogen Oral Rinse, sold as a powdered concentrate, progressively removes dental tartar that harbors bacteria. Pictured here is an early study participant prior to using Periogen. Note the whitish tartar buildup at the base of the teeth. Tartar can take on many shades of color from white to brown. This photo shows the same study participant after 8 weeks of daily Periogen use via a water flosser, also known as a Waterpik. As can be seen, there is no tartar left. Both of these photos were taken by the same dentist located in Seattle, Washington. The x-ray image on the left shows tartar buildup below the gum line before Periogen use. Note the tartar shadow in the white circle. The image on the right is the same area after 8 weeks of Periogen application via a water flosser. As can be seen, the tartar has been removed. Even though Periogen ingredients have been safely used by the food and dental industry for years, we had Periogen thoroughly safety tested to standards higher than what is required of an oral care product using FDA guidelines. Nelson Laboratories of Salt Lake City, Utah performed all of our safety testing. We will now demonstrate how to use Periogen Oral Rinse. The preferred method of Periogen application is via a water flosser, also known as an oral irrigator or Waterpik. Pictured is the Waterpik WP100 water flosser sporting the optional Periogen 90-degree tip. As we like to say, a Periogen deep cleaning starts at home with a bottle of Periogen and a water flosser. We recommend the WP100 by Waterpik as it provides a wide selection of tips and a very good water jet pressure. The advantage of a water flosser is that the water jet can reach down into the gum tooth margin 6 millimeters or more. As can be seen in this photo, included tips for the WP100 are stored in the lid. The 90-degree tip shown installed on the wand is optional. Tips for the WP100 insert bayonet style. In this photo, the included Waterpik 45-degree pickpocket tip is shown being installed. Remove tips by pressing the small blue release button on the wand. A feature of the WP100 is the ability to rotate tips 360 degrees using the movable C-rated collar on the wand. Be sure to set the water jet pressure on the knob below the on-off switch. When starting out, we recommend a mid-range setting of 5. The higher the water jet pressure, the greater the penetration into the gum tooth margin. It should be noted that the included water pickpocket tip has a recommended setting of 1. This low setting is to prolong tip life. You can use any setting with a pickpocket tip. The trade-off is that the tips wear out faster at higher settings. This is a small price to pay for good oral health. Remove the measuring scoop from inside the bottle. 1 full scoop is the correct amount for most applications that involve a water flosser. Simply place the scoop full of Periogen into the water flosser reservoir. When first using Periogen, if you have very thick or what we call tenacious tartar, you can add an additional scoop of Periogen for a total of 2 scoops per application. Do this for the first 2 weeks or until you begin to see the results you are looking for. After that, you can drop back to 1 scoop per application. Be sure that you do not remove the desiccant. Periogen is hygroscopic, meaning it tends to absorb water out of the air. Without the desiccant, Periogen may become more difficult to scoop from the bottle as the top layer absorbs ambient moisture. Always be sure to secure the lid snugly after removing the desired amount of Periogen. Next, fill the reservoir with warm tap water. We recommend warm water as it is easier on the teeth that may be sensitive to hot or cold. Fill the reservoir with approximately 8 ounces of water. Note the fizzing action as the Periogen ingredients mix. If there is little or no fizzing action, do not worry, the Periogen will work just fine. Reinstall the reservoir. It should snap into place with little effort. Secure the lid and you're ready to go. You can turn off and on the water jet flow with the large blue button located on the side of the wand. Using the wand, irrigate gum tooth margins, pausing between the teeth. Systematically move the water pick wand around the mouth, angling the tip for maximum penetration of the mixture into any dental pockets. The goal is to get the mixture into those dental pockets that have tartar buildup. Once you've irrigated all gum tooth margins, you can use any remaining mixture to make another pass around your mouth or focus on any trouble spots such as the inside of the lower front teeth. Periogen offers an optional 90-degree tip for reaching those hard-to-get areas such as the back of wisdom teeth. Periogen may be applied by swishing in the mouth as you would with any mouthwash. To perform the swishing method, place approximately 1/2 scoop of Periogen into a glass. Fill the glass with warm water and swish the mixture in your mouth for about 30 seconds. Repeat until the solution in the glass is used up. A word about brushing. Some toothpastes coat teeth with an antimicrobial agent, germ killers. These coatings can remain on the teeth for up to 12 hours. While others, designed for sensitive teeth, coat tooth enamel with filler material, the purpose of which is to fill in micro cracks and fissures in the tooth enamel. So we recommend that when brushing, use a natural or simple toothpaste. Toothpaste that coat teeth may reduce Periogen effectiveness. With regard to brushing, Periogen may also be used for brushing when on the go. Similar to the swishing method, place a small amount of Periogen into a glass. Add warm water and dip the brush into the mixture. Then brush as you would with any toothpaste. For dental deep pockets of 12 millimeters or more, you may want to use the Deep Pocket Applicator. The Deep Pocket Applicator is a syringe-style device that allows for irrigation of Periogen solution directly into very deep pockets. Use 1 scoop of Periogen per 8 ounces warm water. The applicator contains orifices on the sides of the syringe tip that ensures complete pocket irrigation. In summary, Periogen powdered concentrate is very economical. One 3-ounce bottle of Periogen makes over 5 gallons of rinse. To put this into perspective, 5 gallons of a typical breath-freshening mouthwash would cost you over $120, while a 3-ounce bottle of Periogen that makes over 5 gallons of tartar-dissolving rinse costs only $29.95. And the best part is that Periogen results are guaranteed. If after trying Periogen you are unsatisfied with the results, we will refund your money. Periogen will remove your tartar buildup in 6 to 8 weeks, but you must be diligent in its use. In summary, Periogen will save you money. This is especially true for those of us who are on costly 3 or 4 month cleaning programs with their dental professional. Daily use of Periogen eliminates the need for those multiple yearly hygienist visits while improving your oral health. For additional information, visit www.periogen.com. Periogen Oral Rinse, raising the bar in oral care.